Hi everyone, my name is Jim Fortunato and I'm a community health educator and a certified tobacco treatment specialist with Redington-Fairview General Hospital. Have you ever thought to yourself, am I ever going to be able to lose weight, be tobacco free, or stick with that exercise program? It is not easy to make lasting health changes and the process can be very frustrating. The good news is that there are positive steps that we can take that can help us to achieve our goals. First of all, how we view the process of change can be critical to our success. For example, as we work to become tobacco-free, what are we telling ourselves when we have a setback? Are we telling ourselves that we are failing and that we will never be tobacco-free? This type of thought process can undermine our success. A better way to look at it is to look at the big picture. So for example, did you know that if you had 100 individuals make an attempt at being tobacco-free today, on average, only 12 out of 100 will be tobacco-free 6 months from now? That means that almost 9 out of 10 individuals will still be using tobacco products. So what can we take away from this statistic? As this statistic highlights, whether it be tobacco, weight loss, or exercise, making lasting health changes can be very difficult for most people, and it often takes many attempts before we are successful. Therefore, it's very important that we are patient with ourselves and that we learn from our attempts at change. By recognizing our efforts and understanding that setbacks are a normal part of the change process, we tend to develop resiliency, and in turn we keep at it and we don't give up. This can be a recipe for success. Now, a second step that we can take is to take some time and explore our reasons for wanting to make a specific health change. It can be very difficult to lose weight and, more importantly, to keep the weight off if we don't have a good reason. Making a written list can be very beneficial. If we like to journal, this can be an excellent way to explore our reasons in more detail. Now, oftentimes, people struggle to make changes because they just don't have a plan. Setting specific and realistic goals can help us to formulate our plan. Now, an example of a non-specific exercise goal might be, I would like to increase my exercise. This doesn't tell us what we need to do to be successful. Now, an example of a specific and realistic goal might be, I am currently walking 3 days a week for 20 minutes. On such and such a date, I will increase my walking to 3 days a week for 30 minutes. By setting specific and realistic goals, we know exactly what we need to do to be successful. Now, oftentimes, as we work towards achieving our goals, we want instant gratification. We want the results now. However, it can be important to understand that small changes and small steps can make a big difference. So, for example, take an individual that is looking to lose 50 pounds. Now, that can be very overwhelming and seem like a major mountain to climb. Another way to look at it is, instead of focusing on losing 50 pounds, maybe we focus on the first 10. By losing 10 pounds, a lot of good things can happen. So for example, our blood pressure, our cholesterol, and our blood sugar can improve substantially. Also, did you know that for every pound you lose, you take 4 pounds off your knee joints? So by losing 10 pounds, you are actually taking 40 pounds off your knee joints with every step that you take. This can be very substantial, especially if you have some challenges with your knees. Also, it can be helpful to identify our barriers. After we identify our barriers, we can begin to look for solutions. By doing this, this can help us to develop further confidence. Now, you've started an exercise program. You've been successful for several months. Wintertime rolls in, you get off track, you get frustrated, and you give up. How can we sustain that exercise program long term? First of all, as we have a setback or a lapse, it's very important that we don't view it as total relapse. As we talked about earlier, setbacks are a normal part of the process. It's okay. Get back on track, learn from the setback, and keep going. Second, pay attention to the health changes that you are starting to see as you make changes. So going back to the exercise example, do you have more energy? Are you feeling more relaxed? Now, stress can oftentimes be one of the biggest reasons for relapse. Now, it's important to understand that we all have stress. However, stress can oftentimes result in us gaining the weight back that we've lost or going back to smoking. So that's why it's important to pre-plan healthy strategies for managing stress. Some examples might include exercise, journaling, talking with a friend, or enjoying a hobby. In summation, as health professionals, we understand that it can be very challenging for most people to make lasting health changes. We also understand that setbacks are a normal part of the change process. That being said, we have seen a lot of individuals have success meeting their wellness goals. Now, if you are looking for support, Redington-Fairview has a number of individuals and excellent programs that can support your wellness needs. Please give me a call at 858-2318, and I can either help you directly or I can refer you to individuals and programs that may help. Thank you and be healthy.